we talk about Lyme disease, but you think about all the other different types of germs that can come from a tick, like Bartonella, Babesia, Ehrlichia, Rocky Mountain Spotted Fever, Miyamotoi, and the list goes on. But what makes it even more interesting, like if you're a nutritionist, this is like mind blowing. In basic biology, you might remember what's called an endosymbiont, which is actually where germs can live inside of other germs, right? Germs can live inside of other germs. So sometimes we have a situation where someone comes in with Lyme disease and we treat them for Lyme disease, like headache and joint pain, but then they come back with stomach aches and severe anxiety and foot pain, which is the clinical picture of Bartonella. And they're like, Jerry, I have a forest phobia. I have not had exposure to ticks in 3 or 4 years. How did I get Bartonella? I'm like, you have endosymbiont Bartonella. As the Lyme disease was killed, then the Bartonella comes out. So this is a very common thing that actually has been scientifically well documented. Plus, these germs living at body temperature can create things like cysts and biofilms, which make it even more complicated. So we might as well start off really big. What does a nutritionist need to know about tick-borne disease? There's actually been several landmark studies that show that Borrelia actually use things like copper, zinc, iron, and manganese as a food source. You want to write that down. So when patients come to me and I really carefully analyze everything they're taking, they're like, oh, I'm taking high dose iron, I'm taking copper, I'm taking manganese. I'm like, listen, you got to stop all of those things because we have good university research that shows that those are actually feeding the same germs we're trying to kill. And there's no way to be a heroic nutritionist better than remembering this data and pointing this out to patients. Now, it is important that we don't completely starve them of these essential minerals. We just don't want to give it to them in excess. So like Hannah put in the slide here, consider at least one cycle of trying to starve the germ by avoiding giving these extra supplements. Plus, you're going to save people money too. It's less stuff they have to buy.
Thank you, Jerry. And then this, I think, is also a really important point as we're laying the foundation here for tick-borne diseases.
Right. So very important. All of these tick diseases trigger an immune response, and the basic immune response is inflammation in the joints, in the plantar fascia, in the gut, even in the lung lining, the nervous system, the vagus nerve. And this is a really important study back from 2015, which showed inflammatory changes specifically in rhesus monkeys that were inoculated with BB, or Borrelia burgdorferi. So this again, think about inflammation. All of you in your practice have your favorite anti-inflammatory diet, where you're also avoiding gluten, you're avoiding wheat. So when you see that Lyme patient in your office tomorrow, think about avoiding those transition metals. Think about being really aggressive with your favorite anti-inflammatory diet. In fact, this study shows when you give people a strong anti-inflammatory, like a steroid, like dexamethasone, they feel better. It doesn't get rid of the germ and it prolongs the problem, but that really proved this concept of inflammation as a baseline symptom.
Yeah, and I think, thank you for giving this additional overview, Jerry. This is actually one of the, so now if you think about, how do tick-borne diseases affect the gut? One of the big things, as Jerry mentioned, which I'm actually listing here as number 3, is this: you have systemic inflammation. So it's not just, the pathogens themselves that are being attacked by the immune system. You actually have inflammation in all these different parts in the body, which can often make it so difficult to kind of restore the overall health of someone with a tick-borne disease. Inflammation in the gut can often lead to leaky gut, which is when the gut barrier becomes, leaky, and toxins and other unwanted substances leak into the body, which in turn can trigger your immune system even further. lead to neuroinflammation, brain fog, low energy, a whole cascade of issues. In addition, tick-borne diseases also affect the gut in a variety of other ways. So I'll start back at the top here. The first one, which is kind of the most obvious one, is oftentimes tick-borne diseases get treated with antibiotics or other antimicrobial treatments, many of which diminish the gut microbiome and your good gut bacteria. So the first and foremost is thinking about, how do you restore and support gut health during and after treatment? The second is the immune system itself. 70 to 80% of the body's immune system lives in the gut. If the immune system is dysregulated and our gut flora is imbalanced, this can give rise to a whole host of issues, including, food sensitivities, a dysregulated immune system, and also opportunistic microorganisms like candida, yeasts, and other things that just further exacerbate our gut dysbiosis. The systemic inflammation I just talked about. And then lastly, and I have a specific question for Jerry here for the end, is, the tick-borne pathogens themselves can actually elicit GI issues. And so if you look at the Global Lyme Alliance here as a source, they estimate that 5 to 23% of Lyme patients suffer from GI issues. And I know from talking with Jerry that this is also what he sees in his practice, and we'll get into in more detail later how Jerry thinks about this. So, coming from a company that really focuses on the gut microbiome and probiotics specifically, you can leverage the power of the gut microbiome in many ways during tick-borne disease sort of treatment, and also I would say like post-treatment recovery. The first one is, gut flora restoration. So restoring this bacterial diversity that you need, making sure you have the right good bacteria in the right quantity, that will both, strengthen the gut flora and also help eliminate pathogenic bacteria. That we just mentioned leaky gut. Obviously, specific probiotic strains can reduce the inflammation in the intestine and stabilize the gut barrier. One of our products, Omni-Biotic Stress Release, actually has shown in multiple clinical studies to reduce zonulin, which is one of the main markers of leaky gut. It's a reduction of 48+%, depending on what study you look at. Detoxification support. If the body is struggling, if we are taking medications, oftentimes the liver and our detoxification organs are burdened or overburdened. And so that's something to consider. And again, one of our formulations, Omni-Biotic Detox, targets this gut-liver connection and supports liver function. The gut-brain axis, many patients with tick-borne diseases struggle with reduced mental clarity, reduced energy levels, brain fog, things like that. So also thinking, how can you support the gut-brain axis? And lastly, just immune balance, helping to rebalance the immune system. So that was tick-borne diseases. Now let's just take a quick focus here on what is Omni-Biotic? What is this product or this brand that Carrie is also so passionate about? So in short, Omni-Biotic is a highly effective line of probiotics from Europe that are targeting specific health needs. So as you can see here on the picture, we have these 5 formulations here in the US, each of which has mindfully combined strains with specific endpoints in mind. And then we test clinically for these endpoints to demonstrate that that's actually what the product is doing. So, a little bit of background. Omni-Biotic as a product line originates in Europe. It was founded in the early 1990s by Anita Frauwallner in Austria. It has since become the leading probiotic brand across Central Europe. In many countries, it's the top recommended probiotic brand, and it is actually ranked #3 probiotic brand worldwide if you look at IQVIA data. We launched here in the US in 2019, and actually a little bit like a year and a half later, we won the Probiotic of the Year award by Nutra Ingredients for Omni-Biotic stress release. And then the consecutive 2 years, we were one of the finalists. And, you know, one of the main reason was that the judges really recognized the depth of clinical studies and science that is behind these products. So, you know, why targeted formulations? Well, the gut, as we already covered, impacts so much more than just digestion. However, we also know that different strains do different things in the body. So you can't just take like 10 strains and throw them together and hope that they will do all of this. You need to be more targeted, and you need to really combine the strains that you know do certain things. So this is the premise behind Omni-Biotic. So as I said, you know, each of the strains that are used in our formulations are tested and selected for their specific strength. Then they are combined to, you know, mindfully combined with these endpoints in mind of what we're trying to reach, and clinically tested in labs, in preclinical studies, and in human clinical trials. And lastly, Omni-Biotic is also, you know, formulated with a very specific delivery mechanism that really ensures a high survival rate through the intestines, so that you're actually getting the bacteria alive and metabolically active into your intestines. This is actually, we looked at this. So we compared Omni-Biotic versus 10 leading US brands. Many of those were capsules. For Omni-Biotic, 83% of the Omni-Biotic formulation bacteria reach the intestines alive and metabolically active, compared to an average of 7% across these 10 leading brands. So when clients or patients of yours say, oh, I tried this random probiotic from CVS, it didn't do anything for me, my first question would always be, what was it? Was it single strain or multi-strain? Because oftentimes just adding one single strain, if your gut is in dysbiosis, is not going to be very beneficial. And then also, you know, how well researched was it? Was it a high quality product? Were you actually getting these probiotic bacteria alive and active into your intestines? So, you know, just to quickly go through, I mentioned some of these products before. Omni-Biotic AB10 is our gut microbiome restoration product. Omni-Biotic stress release is our psychobiotic that really supports the gut-brain axis. Again, we have clinical studies for each of these products. Some of the highlights for stress release is we looked at a study with healthy volunteers and their memory and attention, and we found a 2.5x improvement in response accuracy and a 2x improvement in memory function here in that study. And then we also, in various studies, have shown some of these improvements in, you know, reducing inflammatory markers, strengthening the gut barrier, reduction in zonulin. Omni-Biotic Detox is the gut-liver axis formulation. Omni-Biotic Panda is our prenatal and baby probiotic. And then Omni-Biotic Balance is really for immune system support. And then many people also really like to take that for constipation and yeast. So, and Jerry, I think, also has some stories on some of these products. So we'll get there soon. Yeah, so then, you know, kind of going back to the slide that we looked at earlier, this idea that we can leverage the power of the gut microbiome during tick-borne disease recovery. This is really the beauty of Omni-Biotic, is you can pick the formulation that best suits what you're hoping to support this client or patient with. So if you have a dysbiotic gut, maybe you start with gut flora restoration with Omni-Biotic AB10. If you are, you know, if the patient is already at a point where maybe they've completed treatment, but now they're just dealing with the after effects of leaky gut and lots of inflammation in the intestines and, you know, brain fog, low energy, maybe it's Omni-Biotic stress release that they should start with. And then there is, you know, if you're looking to for detoxification support, Omni-Biotic Detox is a really great option, and then Omni-Biotic Balance here for immune support. So yeah, so Jerry, without further ado, I think, you know, it would be amazing for you to share some of your clinical insights here on, you know, how how you, and we've teed up some questions here just to kind of keep the conversation a little bit focused. But before we dive into that, let me just quickly see if anyone has questions so far. So there's a question from Peggy. So what do you do if someone has a couple of different needs, but your products are targeted specifically? Would you ever recommend more than one? So I'm happy to start, and then Jerry, feel free to chime in. You can certainly combine more than one formulation. In fact, it's quite common. For example, even when I had Lyme, I was, supporting my gut with AB10 for the antibiotic side effects. And then I was always on Omni-Biotic stress release to also manage the inflammation in my intestines and the leaky gut. The other option is to kind of also take a staggered approach. Oftentimes you maybe first need to address a gut dysbiosis and get rid of these pathogenic bacteria before you can focus on, reducing the inflammation, because the dysbiosis certainly is contributing to that. Jerry, what do you think?
I mean, I definitely agree. And I'm famous for mixing and matching as well. For example, like detox and stress release is a big combo. But people, part of what makes what all of us in this room do magical is we actually get, the patient's feedback. Like I had someone where they were doing AB10, which has that unique strain of E. coli to really help to restore that microbial balance. And they were having pain with fatty food and right upper quadrant pain and shoulder pain, and their liver enzymes were actually going up instead of down. So I switched them to detox for more targeted liver support to get that stimulated, increase the fiber to work on the gut. And then I said, keep the AB10 on the shelf and we'll use that in a week or two or longer based on what your actual response is. So again, what we do here that's magical is you're getting that feedback from the patient as you're putting in each of these different interventions. Yeah, mix and match all the time. I like even the balance as vaginal douche for severe, vaginal yeast, and they do a little bit orally as well. So.
Awesome. So Jerry, let's dive into some of these questions, and then please, everybody, as we're talking more kind of on the clinical side here, feel free to also add more questions in the chat. But Jerry, from your perspective, how do you see the role of the gut in tick-borne illnesses and in the recovery?
Got it. Great. So just to roll back one little bit, an important thing to remember is that the symptoms of all of these tick diseases are very vague and present in many different ways and usually affect different organ systems like fatigue and joints or joints and brain. So be on the alert for people with this complex of vague symptoms that maybe have been to a lot of other doctors' offices. They're really not getting a lot of answers. Maybe your approach in Alaska would be different from the East Coast. But one of the reasons we're here this afternoon is to remind you to keep tick-borne disease and tick-borne illness really high up on your radar. Now, to think of this first question, what do we think of the gut in tick-borne illness? It's important to remember there are some infections like Bartonella, which maybe you know as cat scratch fever. The flea bites the cat and the cat scratches you, but the tick can transmit that same Bartonella germ. So we can get that Bartonella cat scratch fever from a cat or from a tick. Bartonella is probably the most famous infection that will directly go to the gut. And when we look for Bartonella, we think of gut issues, gas, bloating, burping, nervous stomach, butterflies in your stomach, diarrhea, cramping after you eat, usually combined with the neurologic symptoms of cat scratch fever, especially like anxiety. So we'll look for those acute gut symptoms in someone, for example, with Bartonella. Now, the immunologic changes of a persistent infection, people, write this down. It's 2023. We don't say chronic Lyme disease. We say persistent Lyme, which is what the literature really supports. So persistent Lyme's weakening of the immune system is going to affect, especially that natural killer, that innate immune kind of response that we see from the gut that Hannah was talking about on that previous slide. So you're going to see that gradual reduction in immune function. On the flip side, we know the hallmark of tick diseases is a lot of inflammation. So you've got a high rate of burn, you're burning through your immune resources. And as your gut gets weaker and also inflamed, you're then producing less, which is why what we were saying before is your first big step in nutrition is avoid transition metals. Your second big step is push your favorite anti-inflammatory diet really hard. Now, recovery, for those of you able to order blood work, we use what's called IgA, the immunoglobulin A, which is the mucosal marker of the intestinal lining. The lower the IgA, the more disrupted the gut is going to be. And we've really found that making sure you have a normal gut mucosal lining and a good immunoglobulin A is key to any future success. The first step in building that gut mucosa is just making sure people are getting enough fiber. Fiber is great for detox. It's a great binder. It controls carb cravings. And then we work on the amino acid glutamine. High dose glutamine is critical for those tight junctions. Now, people, this is where you would roll in that Omni-Biotic. So I always say, get your fiber in, like 25 grams of fiber, work up to that slowly. Make sure you're getting glutamine. Now that you've kind of got that soil laid, you put in that Omni-Biotic. And people, this is where you're going to see, the power of these particular products, especially the brain fog clearing of detox, as well as that stress response for our PTSD and chronic anxiety type people. So I don't jump to the Omni-Biotic at that very first visit. I kind of lay that foundation. So when we do put it in, we really know that it's going to work. So your job as the nutritionist is really to facilitate this whole gut healing, which in a typical 15-minute doctor's office may never even come up. And then just lastly to mention, many will be on high dose antibiotics, which will need to counteract. I think that the AB10 is probably the key for people that are on antibiotics or people on long-term, proton pump inhibitors.
Yeah. Jerry, two quick questions. The first is, can you please clarify transition metals?
Yes, those were what Hannah showed in that early slide, which were the people taking manganese, taking copper, taking zinc. Now, as I said, we need those to survive for our vital functions, but in excess, those things are going, here we go, right? Again, not Jerry and Hannah blowing hot air on a Thursday. This is real documented scientific literature that shows that, manganese, copper, zinc, iron are what we call these transition metals and will literally be feeding the Lyme germ. The Lyme germ depends on us for nutrition. So again, it's a balancing act. Severe iron deficiency, severe copper deficiency are going to be issues, but it's these people taking them regularly and in higher doses where we actually see more cyst, more biofilm, more resistant Borrelia. And I will literally tell people, I'll help you, but you've got to not feed these germs we're trying to kill every day. You know what I mean? So again, if you've got your phone, snap a picture of that, or hopefully we'll get you these slides to you at the conclusion. So.
Great. And then the next question is, I've had 2 tick bites. I've never been tested. I have candida and other concerns. I've never thought about bringing this up to my doctor, but I will ASAP. Where would someone like me start?
Yes, fantastic. So we may never know the answer to this, but a lot of it depends on having an idea of what kind of tick bit you. For example, we know that the big fat wood tick will give you rickettsia. The Lone Star tick will give you the dreaded alpha-gal meat allergy. And I'll tell you, there's a special way to use Omni-Biotic with alpha-gal meat allergy, but that'd be a whole nother hour. But that would be a great topic. The deer tick, of course, would give you Lyme disease. So having candida after a tick bite would point to what Hannah was saying about this immune deregulation, the immune weakness, which would make you more susceptible to having candida. And remember what we said, tick-borne disease symptoms are vague and multi-organ, like headaches and joints, or muscles and joints, or gut and brain. So if you've got more than one organ system with candida and 2 tick bites, typically you would want to start by getting, a basic test done. IGeneX, Vibrant Lab, MDL are some of the more accurate testings.
And then Jerry, just real quick on testing, can you speak to the fact that the test that most primary care doctors, like the ELISA blot test, is really not that accurate, and what type of testing should we be looking for?
Yes, exactly. So people, and every opportunity I have to talk to anyone, even when I talk to my mailman, I remind him that the Center for Disease Control website clearly says that Lyme is a clinical diagnosis. Blood work may be helpful, but it's not required to diagnose. So it drives me bonkers when someone says, I don't have Lyme because my blood test is negative. So I'm like, you want to go fight the government on that? Because they're saying, don't believe your blood test. So, but yeah, what Hannah's talking about is most of these blood tests are notoriously inaccurate. And a lot of times it's just this clinical intuition, listening to the story and putting things together. But we know that IGeneX, which is on the West Coast, Vibrant Lab, and MDL here on the East Coast have some of the more accurate type Lyme disease testing. So that would be kind of the basic way to go. There are some alternative practitioners that will do muscle testing, that will do electrodermal type skin testing, which I've seen some limited success with, but that might give you a little bit of extra direction that way.
Thank you, Jerry.
Just lastly, some people I've literally said, there are so many herbs and essential oils that help Lyme disease. You could take one of those for 3 weeks and see if you notice a difference. Everybody, you might remember something called the Herxheimer reaction, which is where you feel worse before you get better. And I've literally had patients say, Jerry, you're really bad. I took these herbs and this medicine and I feel worse. I'm like, you feel worse? Congratulations. That's the Herxheimer. If you stop taking the medicine now, you're just going to make more cyst and more biofilm. So besides ordering a bad blood test, another common doctor's office mistake is someone calls during Lyme treatment, they feel worse, everyone panics, and they stop the treatment, and those germs just get into a much stronger form.
Great. So let's move to the next question here. So how frequently, Jerry, do you see GI issues in patients with tick-borne illnesses, and what are the most common ones? You've sort of addressed it already, but let's get a little bit more into it.
Yes, people remember the trilogy: foot pain, especially in the morning, all kinds of stomach and GI issues, and anxiety is the classic trilogy of Bartonella, right? And that we would see very early on after a tick bite. You have a deer tick bite and you start getting these issues within a week or two. Lyme disease itself can trigger gut inflammation, which could cause initially diarrhea, right? You remember that. Inflammation of the gut, the first thing you see is diarrhea because you're getting this malabsorption. And that progresses to SIBO and then this whole leaky gut type of dysbiosis. So Lyme disease patients will have more long-term GI issues, reflecting things like SIBO and dysbiosis, gas and bloating. Many Lyme patients actually have a deficiency in bile acid. So we'll see people, I'm like, all your fat soluble vitamins, A, D, E, and K are very, very low. And even with supplementation, they're not going up. That's a red flag that they've got low bile acid. They're not able to break down those essential fats. And of course, candida, like we were just talking about in the chat, is a very common thing, usually from prescription antimicrobials. So think about the trilogy, think about, the butterflies, the nervous stomach, the diarrhea, and, right upper quadrant pain especially is very common because of the liver and the gallbladder there. But look for gas, bloating, and just same way your knee can hurt, your abdomen can hurt from having Lyme as well.
And Jerry, I know I earlier cited the 5 to 23% as an estimate by the Global Lyme Alliance of Lyme patients who have GI issues. In your practice, how many of your tick-borne illness patients would you say have GI issues at some point?
Right. So remember that GLA data is specifically Borrelia burgdorferi affecting the gut. So when they come to us, they've got candida, they've got antibiotic effects, they've got bad diet, they've got transition metals. So more than half of people that come to me for an initial visit have something crazy going on with their gut.
Mm-hmm. Yeah, that's even just talking to others who had tick-borne illnesses. I feel like 90% in my circle at least have some sort of GI issues, whether that's random new food sensitivities that came up because of a dysregulated immune system, or constipation or gas or candida or something.
Yeah, food allergies that they never ever had. Right.
What's your approach in addressing or improving the gut in tick-borne disease patients?
Right. So kind of just to review what I had said, another way to ask this question is, what are you going to do different tomorrow because you were here today? Number one is avoid those transition metals, right? Number two, pick your favorite anti-inflammatory diet and push it hard every time, especially avoid gluten and lactose. Number three, get that fiber up, whether they're eating it just through food or doing your favorite fiber supplementation. Number three, if you can get that immunoglobulin A or some basic stool studies, if their IgA level is low, they must have glutamine. Not sometimes, not if you're in the mood, not if it's on sale. They must have glutamine. And then only then would you roll in either the AB10, if you're looking for kind of basically a foundational restore. If they're having brain fog, forgetfulness, start with the Hetox. If they're having a lot of butterflies and nervous stomach, you'd start with the stress formula. Every once in a while, you'll see an adult that has something called Marcons, which is a methicillin-resistant staph in the nose, and a little colloidal silver, and then a bottle with some saline and some Panda as a nasal spray, and taken orally would work really well with that as a great combination. So people, I use Omni-Biotic more than just orally. I've used it as a paste for a rash. I've used it intravaginally. I've used it rectally. I've used it as a nasal rinse. So as you get more and more experience with it, you'll find that it can be useful in many different ways besides just drinking it.
Yeah, that's I feel like every time I talk to you, Jerry, there's a new experiment you ran.
Oh, it's not experiment. It's all scientifically.
No, that is true. That is true.
Exactly.
You've tried a new approach.
Right.
So, I feel like you just kind of talked probiotics, but maybe we can dive a little bit also from your perspective into, when you think about probiotics in this whole tick-borne disease journey, what are kind of the main reasons why you incorporate them, if that makes sense? I feel you've talked to me about so many different aspects, but maybe you can share a little bit more there.
Right. So again, the main idea is whether it's the infection, whether it's the immune depletion, whether it's diet or lifestyle, whether it's antibiotics. Your typical tick-borne disease patient has been depleting their microbiome, not enhancing it over time. And as we've said, it's this basic gut mucosa with the microbiome on top of it, which is critical for all the function of the immune system. You know, the innate, the adaptive components of the immune system. We look at natural killer cells a lot. We measure a marker called CD57, which has been particularly good in marking the degree of activity of Lyme there. But again, remember, when you're dosing probiotics, you're always talking about dosing probiotics in the billions with a B. Every once in a while, a patient will come like, oh, I got this probiotic on sale from Costco, and it's almost 800 million with an M. I'm like, I think you're wasting your money. There are trillions of germs in the gut. And to exert any kind of influence on those trillions of germs, you need to be taking billions of CFU of probiotic. And again, one of the reasons I gravitate towards Omni-Biotic is they have the data that shows that it's not just destroyed by stomach acid, that it's actually getting into the gut where you need it to be absorbed that way. So that delivery mechanism, I really think is cool.
Yeah, and actually, Jerry, I realized we haven't talked at all about the delivery mechanism, so I will just do 1 or 2 minutes quickly on this because we are quite passionate about this. So
We've got to, that's why we use it.
So as you might have gathered from Jerry, you know, when Jerry said he uses it as a paste and in all kinds of various ways, one of the reasons why Omni-Biotic is so versatile is because it's a powder. It's not a capsule. It comes in these little daily pouches. It doesn't require refrigeration, and it's so easy to just put them also on the go. Like I have one in every one of my backpacks and handbags, and many people like it that way. But the reason why it's a powder is because the freeze-dried probiotic bacteria are combined with specific prebiotic nutrients in this powder. And when you dissolve this powder in water prior to intake, you actually allow these bacteria to rehydrate, start to metabolize the prebiotic nutrients we added into the powder, and that makes them metabolically really strong so that they can survive the passage through the stomach acid, through the bile juices and all that they encounter in the upper part of the small intestine, and they reach the intestines alive and metabolically active so that they're in tip-top shape. They can do their job there, they can colonize and reproduce. This is different if you have a capsule of freeze-dried bacteria, because when that opens in an acidic part of your GI tract, the first thing that a freeze-dried species will do is they will soak up any liquid they come in contact with. So if that liquid is your stomach acid, they're literally just dying because they are exposed to, they've just soaked up all this acid. So this is an important reason behind why Omni-Biotic is so effective. We're ensuring that a lot more of the bacteria get to your intestines alive and active. But anyways, that's just a little side note on the delivery mechanism. Jerry, we had a few more questions, so I'm just gonna go back to them. So the first one is from Lisa. Is it possible to have either Lyme or Bartonella, perhaps from an incident from an earlier age, and now just becoming aware that this may be a possibility after years of inflammation issues? Can testing now take place as a young adult to reveal if this is what is present?
Yeah, Lisa, this actually happens more commonly than you think. Several times a year, I have patients that come to me and they're like, I'm like 30, I'm healthy, I've got aches and pains, my knees hurt at the end of the day, I get headaches and I need a lot of ibuprofen, but my nephew was over, he gave me bad bronchitis. I went to the urgent care and I got antibiotics and my headaches disappeared, my joints disappeared. I'm like, okay, you took antibiotics and all of these vague multi-organ system complaints improved, right? What does that tell you, right? And same thing, like, oh, I took an antibiotic or I took an antimicrobial herb, cat's claw and Japanese knotweed, and I took an antimicrobial and my knees swelled up like watermelons. Like, okay, you took a Lyme antimicrobial and you've had a Herxheimer. That's more diagnostic than any blood test could be. But yeah, Lisa, there's a lot of good data that shows that Borrelia burgdorferi can persist and it can live in your system, kind of like how chickenpox or the shingles can persist for decades. And as you get older, your immune system does weaken, and that weakening of the immune system can sometimes trigger this, as well as a stressful event. Divorce, financial, a car accident. I've had people where it can give them shingles. It can also give them Lyme symptoms. And post-COVID can affect a lot of this as well.
Yeah, and I think maybe to add on to that, there are tests, like this is where the testing gets kind of tricky, but there are more advanced tests. You can do antibody tests and even you can test for I think gene fragments of these bacteria.
Urine provocation testing.
Yeah, so you can do you can actually do tests. Again, there are some false negatives, unfortunately, that can be misleading, but there are tests that you can do even if you think you had this infection years or even decades in your body. It's just that's where it gets a little bit more complicated. But I would say yes, you can certainly, get a better understanding through testing as well. So the next question is with a smiley face. I tried to get an appointment with you for my sister, but you're not taking new clients. Any suggestions? I feel like she could have Lyme. Her symptoms are severe. This is the story of Jerry and the Morrison Center.
I know. I'll put my email in there. I have a waiting list, which is open up now, and I've had a couple new people coming in. So
awesome. So there's hope. Let's see. Can you expand a little more on the herbs and oils that can help with someone while someone is being treated?
Yeah, so Peggy, this could be a whole nother hour, but this is really, really, really revolutionary. About 10 years ago, Dr. Eva Sapi, S-A-P-I, from the University of New Haven, published on cat's claw and banderol being equivalent to doxycycline, which, was really, really remarkable. Fast forward to 3 or 4 years ago, Johns Hopkins, the big guys, published on essential oils like cloves, cinnamon, oregano being antimicrobial, even really targeted to cyst and biofilm. And just about 5 or 6 days ago, Samuel Shore published his big article on bioactive nutraceuticals for tick-borne diseases. That you could Google that. That literally just came out. I might have that link here I can give you. So definitely a lot of really powerful things you can do without ever getting a prescription.
Thank you. I work at a practice as a nutrition coach, and one of the doctors there really specializes with Lyme patients. So I do get some nutrition. I do get some clients to coach that are part of what they're dealing with is Lyme. And sometimes it is like undiagnosed Lyme from years and years ago, or that's what they're told. And it's a bit of a fuzzy area for me because I know they're being treated with antibiotics, and I'm concerned about that. But now you've given me some tools, at least from the nutrition standpoint, of how I can better help them with that piece. In addition to, obviously, they're coming to me because they want to just lose weight and feel better and be more energetic and all of the above. So,
right. But Peggy, remember, when that person's like, oh, I feel terrible, dig through those symptoms and see if it's a Herxheimer, if it's a worsening or not. People click on this link. This is the $1 million link, Sam Shore's new article. that just came out. But hopefully Peggy and everyone wrote down our list of what are you doing different tomorrow.